Well, good morning. We're here to talk a little bit about health care, both nationally and federally. I had the honor of serving as one of the 4 members of Congress to witness the Supreme Court's deliberation on the constitutionality of the Affordable Health Care Act, often referred to as Obamacare, that was passed by the Congress last year. As many folks know, this is a bill that was passed on a party line vote in the House and the Senate. Since that time, the American people have become aware of the bill, and it has become more and more unpopular since it was passed a year ago. Just over half of the American people opposed it when it was passed. Over 65% of the American people want it repealed completely, and it's why the United States Congress and the House of Representatives has voted over 12 times in the last year to fully repeal the Obamacare health care law. That, coupled with the uncertainty with the Supreme Court now deliberating, the media coverage and the legal pundits have suggested that the law has some serious flaws, and there's a likelihood that the Supreme Court will overturn the law and rule it unconstitutional. And that has significant impacts not only on the federal government, but also on states' government as well here in Illinois. Our estimates are that the Obamacare health care law will require 700,000 new Illinoisans to go on programs like Medicaid. This would be about a 25% increase over the current enrollment here in the state. Obviously, the state of Illinois is suffering from its own budget difficulties, health care being the largest line item in that budget. And the governor continues to talk about the need to move towards implementing health care exchanges as prescribed by the health care law. And as a federal representative, that concerns me because my representatives in my congressional district are Illinois residents who are suffering from the burden of debt here in the state, the inability for the state to deal with its unfunded liabilities and the liabilities that it owes to providers, and for the governor and the legislature to move down a path that will cost the state of Illinois tens of billions of dollars to implement these exchanges when it's yet uncertain as to whether or not those exchanges should take place or will have to take place seems irresponsible. So I'm calling on the governor and the legislature to slow down, to not move forward with those exchanges until it's clear that, in fact, we have to put them in place, that it's clear, in fact, we have to spend the tens of billions of dollars it would require to implement those exchanges. Beyond that, I think Illinois residents, like the American people, want this law overturned. I, along with the Illinois delegation, a majority of whom, 11 of the 19, wrote to Attorney General Lisa Madigan asking her to join the 26-state lawsuit opposing this bill because the majority of Illinois residents, like the majority of America's residents, oppose this health care law, and we in Illinois, in the legislatures, and the governor's office need to do everything they can to stop its implementation and to limit the amount of money that we're spending to implement this law that is not supported by the majority of our constituents. So beyond that, I know that Leader Cross and his members are very concerned because they've been taking very tough votes and very tough positions to try and balance the budget here in the state, to try and put them on a path towards solvency. And each new mandate from the federal government, each new requirement to spend money that they don't have makes that job that much more difficult. So I'm pleased that Leader Cross and his conference have done such a great job of holding the governor and the legislature's feet to the fire to try and live within its means and not spend money it doesn't have. So with that, I want to turn it over to Leader Tom Cross.
Congressman Schock, thank you, and it's a pleasure to be here with Congressman Schock as well as my colleagues, Representative Dwight Kay, Representative Paul Evans, and we share in the concerns expressed by Congressman Schock of the extreme, huge costs that we are going to see in this state with the potential implementation of Obamacare. I, like Aaron, would argue that it either needs to be repealed or hopefully in the alternative, the courts overturn it. Will put huge pressures on this state from a budget perspective. Think about what this state is going through. Right now we have roughly $8 to $9 billion in unpaid bills. We have a pension unfunded liability of $85 billion. We just had the largest tax increase in the history of this state implemented a short time ago by the Democrats. And with the implementation of Obamacare, we will see in this state potentially, if nothing is done with respect to reforms and cuts in the next 5 years, $21 billion in backlog of bills in Medicaid, and overall as high as $34 billion of unpaid bills. We can't afford that. There are ways to get out of this. Clearly, the repeal and or the overturn is an alternative, but also in this state, we have the ability to implement reforms and cuts in Medicaid that we have done, but we've seen very little action out of the governor in the implementation of those reforms on the Medicaid front. The idea of asking somebody on Medicaid whether or not they can provide more than one pay stub to justify their income or to verify their residency, things that we've passed, but the governor has been very slow to a certain degree to implement that. The idea of scrubbing the rolls, of saying to the 2.8 million people on Medicaid, we're going to go through and make sure and decide whether or not you're still eligible. The idea of doing that, many people would suggest, would maybe take 200,000 to 300,000 people off those rolls and save us several $100 million. The idea of saying to welfare, Medicaid folks, like they've done in just about every other state, if you go to the emergency room and there isn't an emergency, we're going to charge you a copay for as little as $10 or maybe more. That could, again, save us millions of dollars. There are ways to do this. There are ways to save us money, and the reality is if we don't do this, we will be overwhelmed with debt on a variety of fronts. So I want to say thanks to Congressman Schock for his continuous concern about what's going on here in the state of Illinois beyond just his congressional district, making sure that we keep an eye on things like Medicaid and working with us to get our hands on it. And like him, I also share his concerns with the health insurance exchanges. The idea of trying to implement something that we don't know the rules, we don't know the parameters, we don't know the cost, clearly way too early to do that, and I would urge Governor Quinn to slow down, focus on the reforms in Medicaid. Let's get those implemented, and if we need to do the health insurance exchanges, we'll do them at the right time, but clearly now is not the right time. With that, I'd like to turn it over to Representative Dwight Kay, and thank you, Dwight, for being here.
Thank you, Leader Cross. Good morning. My name is Dwight Kay. I'm state representative from the 112th District, Edwardsville, and I'm a businessman as well as a state legislator, so I'd like to talk about this health care mandate from two perspectives. First, as a legislator, I think we understand that the implication of Obamacare is no less than a $540 million expense, moving up to $1 billion between 2014 and 2020. And Illinois has no money, as Leader Cross just mentioned. Furthermore, this plan creates a new bureaucracy, which we're going to be asked to fund. Taxpayers will be forced to pay up to 50% of that bill, and I don't think taxpayers, after a 7% increase in state income tax, have any appetite for that. It's also important to note that taxpayers will be asked to pick up the tab for those individuals that are not eligible but previously enrolled in Medicaid. And by the way, if Illinois decides to sign on to this plan, Illinois will be mandated to follow federal rules, not state rules, with respect to any Obamacare system that is set up in this state. As a businessman, let me just take a little different path here. It concerns all of us in the business community because business across the state has faced higher taxes, and this will simply be another additional tax, and certainly the cost of health care will be an increase to businesses. Put simply, capital needed for, I would say, productive things like job creation, purchase of equipment, research and development, well, that'll cease because that money will be sucked up into a healthcare system that, frankly, is going to be burdensome and simply will not work as well as what we enjoy today. You know, when you talk about transactions of $600 to file 1099s, and that's the average cost to a business that has to file that, or you talk about a business who has to put in machines, vending machines that have caloric numbers, telling people what their caloric intake will be when they purchase certain things out of vending machines is simply destructive to business in the state of Illinois. I want to be very clear today. As a legislator, this is a bad plan. As a businessman, this is a bad plan because we simply can't afford it in the business community, nor can we afford it in Springfield. Thank you, Dean.
Thank you. Representative Evans?
Thank you. I wish to thank Congressman Schock and Leader Cross for taking time out to come here. We have to look at all aspects of government, and as a representative, I hear so many people telling me stories of the misuse of the Medicaid system. I'm very concerned of making sure we prioritize correctly and protect those who need it. And to do that, we need to cut out the fraud and waste. The proposed Obama health care, we have a system in Illinois that's not working now, and we're going to expand it dramatically, and I oppose it simply because we have to make sure we can make our present system work. The recent bill that we passed in the House to start beginning to verify the eligibility for Medicaid is just good common sense. Let's work this through and then slowly address all the other issues out there. And again, I appreciate you being here. Thank you.
All right.
Thank you very much.